It's almost bedtime, which means that it's time for your injection. I took your Omnitrope Vial from the fridge 30 minutes ago, so now it's ready for you to use.
Hi, my name is Dylan. I'm 11. I have a growth hormone disorder. This means that my body doesn't make enough growth hormone to help my bones grow and my muscles develop. To make up for this, I take my Omnitrope replacement growth hormone injections. I'm going to show you how I prepare and inject Omnitrope using a vial. Do not inject Omnitrope yourself until your healthcare provider or OmniSource nurse trainer has taught you and you understand the instructions. First, you will need to collect the necessary items before you begin. Place them on a flat, clean surface. You will need the following: vial containing Omnitrope, 5.8 milligrams. Vial with diluent. Diluent is a mixing liquid. A sterile disposable 3 milliliter syringe and needle for withdrawing the diluent from the vial. A sterile disposable 1 milliliter syringe and needle for under the skin or subcutaneous injection. 2 alcohol swabs. Once you have all the necessary items in front of you, make sure you wash your hands thoroughly before moving on to the next steps. To make sure that everything remains clean and sterile, never touch the needles or the top of the vials. Step 2. Mixing Omnitrope 5.8 milligrams. Time to mix your Omnitrope powder with diluent. Here's how. Remove the protective caps from the 2 vials. Using one of the alcohol swabs, clean the rubber top of the vial that contains the powder and the rubber top of the vial that contains the diluent. Attach the needle to the 3 milliliter syringe if not already attached. Pull back the syringe plunger and fill the syringe with air. Go ahead and push the needle fitted to the syringe through the rubber top of the vial containing the diluent. Push all the air from the syringe into the vial. Turn the vial upside down. Withdraw all the diluent from the vial into the syringe. Remove the syringe and needle from the vial. Next, take the syringe with the diluent in it and push the needle through the rubber stopper of the vial that contains the white powder. Inject the diluent slowly into the vial, aiming the stream of liquid against the glass wall of the vial to avoid foam. Once all diluent is injected into the vial, remove the syringe and needle and dispose of them. At this time, you will need to gently swirl the vial until the powder is completely dissolved. Do not shake. Use a gently swirling motion only. Inspect the vial. If the liquid is discolored or contains particles, do not use. The medicine must be clear and colorless after mixing. Store the vial in the fridge at a temperature between 36 to 46 degrees Fahrenheit each time after mixing and using it. After mixing the medicine, it must be used within 3 weeks. Step 3. Measuring the dose of Omnitrope, 5.8 milligrams to be injected. You will be using the sterile disposable 1 milliliter syringe or similar and needle for subcutaneous injection. Begin by pushing the needle through the rubber top of the vial that contains the medicine that you have just mixed. Next, turn the vial and syringe upside down, making sure that the tip of the syringe is in the Omnitrope mixed medicine liquid. Pull back on the syringe slowly and withdraw the dose prescribed by your doctor into the syringe. Hold the syringe with the needle and vial pointing up and remove the needle from the vial. Check for air bubbles in the syringe. If you see any bubbles, pull the plunger slightly back and tap the syringe gently with the needle facing upwards until the bubbles disappear. Then push the plunger slowly back up to the correct dose. If there was not enough medicine in the syringe after removing the air bubbles, draw more medicine into the syringe from the mixed medicine vial and repeat the check for bubbles. Look at the mixed medicine liquid in the syringe before using. If the liquid is discolored or particles are present, do not use. If everything looks okay, you are now ready to inject the dose. Step 4. Injecting Omnitrope 5.8 milligrams. Here's how to inject Omnitrope. Choose the site for injection on your body. The best sites for injection are tissues with layers of fat between skin and muscle, such as the upper leg thigh area, the buttocks, or stomach area. Do not inject near your belly button or waistline. Make sure you rotate the injection sites on your body. Inject at least half an inch from the last injection. Before you make an injection, clean your skin well with a second alcohol swab. Wait for the area to air dry. To inject, Using one hand, pinch a fold of loose skin at the injection site. With your other hand, hold the syringe as you would a pencil. Insert the needle through the pinched skin, straight in or at a slight angle. After the needle is in, remove the hand used to pinch the skin and use it to hold the syringe barrel. Pull back on the plunger very slightly with the other hand. If blood comes back into the syringe, then the needle has entered a blood vessel. Do not inject if you see blood in the syringe. Remove the needle and repeat the steps in this section at a different site. If no blood comes into the syringe, inject the solution by pushing the plunger gently all the way down. Then pull the needle straight out of the skin. After injection, press the injection site with a small bandage or sterile gauze if needed for bleeding. Hold for several seconds. Do not massage or rub the injection site. Step 5. After injecting Omnitrope 5.8 milligrams. When you are done with injecting, discard the injection materials as follows. Syringes should be safely disposed of in a closed container. You can ask your healthcare provider or pharmacist for a sharps container, which is a special container to put used needles and syringes in. The vial of mixed medicine must be stored in the refrigerator at 36 to 46 degrees Fahrenheit and used within 3 weeks. If the solution is discolored or contains particles, discard the vial. Do not inject the medicine from this vial. Instead, start over with a new vial. Before each use, disinfect the rubber top of the mixed medicines vial with an alcohol swab. You must use a new 1 milliliter syringe or similar and needle for each injection.
Great job, Dylan. And don't forget, you have to throw away the used syringes in the special container, not the garbage.
I sure do. Thanks, Dad. Well, I guess it's time for me to go to bed now. Good night.
Important safety information. Omnitrope should not be used in children and adults with any of the following medical conditions because serious side effects, including death, can occur. A critical illness caused by certain types of heart or stomach surgery, serious injury, or a sudden and severe breathing problem or respiratory failure. Prader-Willi syndrome, who are severely overweight or have a history of breathing problems including sleep apnea, cancer or other tumors, allergies to growth hormone or any of the ingredients in the medicine, certain types of eye problems caused by diabetes. Omnitrope should also not be used in children who have completed growth. Patients should tell their doctor about their medical and family history, treatment use, and past and existing medical conditions, such as but not limited to the following: cancer or any tumor, diabetes, use of prescription and non-prescription medicines, steroids, vitamins, and herbal supplements, pregnancy, nursing. The most common side effects of Omnitrope are local reactions at the injection site, such as pain, numbness, redness, and swelling, headaches, swelling associated with fluid retention, pain in joints and muscle pain, carpal tunnel syndrome, tingling and numbness, high blood sugar, hyperglycemia or diabetes, and sugar in your urine, glucosuria, unusual skin sensations, low levels of thyroid hormone or hypothyroidism. The other possible side effects of Omnitrope are return of tumor or cancerous growths, headaches, changes in vision, nausea, or vomiting. These may be symptoms of raised pressure in the brain, which requires immediate medical attention. Hip and knee pain, or a limp in children, that can be a sign of slipped capital femoral epiphysis. Worsening of pre-existing curvature of the spine in children, or scoliosis. Increased ear infections and ear disorders in children with Turner syndrome. Check for cardiovascular disorders, hypertension, and stroke. Intense pain and tenderness in the abdomen as consequence of an inflammation of the pancreas, or pancreatitis. Gasping syndrome, decreased rate of breathing in children from high levels of benzyl alcohol, an inactive ingredient. Increased mortality in patients with Prader-Willi and acute illness. Please see full prescribing information for Omnitrope available at omnitrope.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. To report suspected adverse reactions, contact Sandoz Incorporated at 1-800-525-8747 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.